Hi, everyone, and welcome to Fam Health. As we know, World Heart Day is celebrated on September 29th as part of a global initiative to enhance awareness about cardiovascular disease and also to inform people about various risk factors that they can potentially avoid in order to reduce the risk of heart disease. Today, we have the distinct pleasure of talking with Dr. C.N. Manjunath, who is the director at Jayadeva Institute of Cardiology. Thank you, sir, so much for joining us today. We know you have a busy schedule and we really appreciate your time. Sir, I just wanted to ask you, we talk a lot about various metrics that we think about when we think about heart health, and one of them is cholesterol. So what is the role of cholesterol really in CVD?
Yeah, see, sometimes among some people there is a misconception. There is no relation between cholesterol and heart disease, and so people say no. I think today we are in an era of what is called EDR syndrome. The EDR syndrome is internet-derived information obstructing treatment. So a lot of misinformation, misconception is, going through this WhatsApp or Facebook, telling that you can eat plenty of cholesterol, you can nothing will happen. Our ancestors, our forefathers were eating lot of ghee, lot of all those stuff, so nothing will happen. So that sort of a misconception is going through this social media. There is a definite correlation between your cholesterol and coronary artery disease or blockages of the arteries in the heart. Because for every 1% increase in total cholesterol, there is 2% increase in the incidence of cardiovascular disease. I will just give an example. We have an entity what is called familial hypercholesterolemia, where cholesterol metabolism is abnormal right from birth, and many of these patients die due to premature heart attack at an age of 15, 20, 25 years. So what more evidence you want? And also there is another misconception that only some people say, I am very lean, I am underweight, my cholesterol, why it is high? So there is no correlation between your blood cholesterol and your body weight. Somebody can be having a lean personality or maybe underweight, their cholesterol can be still high. So not necessarily that only obese people should have high cholesterol, and those who are having low weight, lesser weight, will not be having cholesterol. And definitely cholesterol has got a significant role to play. There are many types of cholesterol, as we all know. One is good cholesterol, that is called HDL cholesterol. Then we have what is called LDL, which is a bad cholesterol. So most important is we should have more of good cholesterol, that is HDL, and less of LDL cholesterol, which is a bad cholesterol. Of late, even triglyceride is also emerging as a risk factor. So in India, most of the patients do have this combination of what is called high triglyceride and low HDL. So there is a strong, robust evidence that cholesterol is an important risk factor for heart attack related diseases.
As we're talking about the theme, one of the themes of World Heart Day is how to make perfect choices or make better choices in order to maintain a healthy heart. And part of that, of course, has to do with food and nutrition. So in your opinion, sir, which oils are good or bad, and what is the role of exercise in maintaining heart health?
I'm not telling ghee is bad. Some amount of, see, you can eat everything, but in a smaller quantity. Ultimately, that is size of the diet is important. I'm not telling ghee is bad. Because we need, whether it is salt, whether it is a bit of small cholesterol, in optimal quantity, it is very essential for maintaining a good health. So as far as food is concerned, food should be a low calorie, low fat diet, and more of fibers and more of vegetables and fruits, and what we used to call as a Mediterranean diet. So ultimately, we have to have, in fact, more emphasis on today low carbohydrate or low sugar diet is very, very important. So this is how we should have, and all fast foods one should avoid. What is the definition of fast food? The food that takes away your life very fast is your fast food. So burgers, fast foods, and all those French fries, and this red meat and all you should avoid. And if somebody is a non-vegetarian, they can have fish, they can have chicken, lean chicken, all those things. Ultimately, these things are very, very important. And apparently, healthy individuals, so maybe 45 minutes to 1 hour exercise is recommended actually. Ideally, is about 45 minutes. The best exercises are still walking. Maybe walking or jogging or cycling or swimming. These are what is called isotonic exercises. That means isotonic exercise like this. This is isotonic exercise. If you are trying to lift the weight, it is an isometric exercise. We should avoid as far as possible this isometric exercise. Isotonic exercise or relaxation, alternate flexion, extension, this sort of thing. So I think there is enough data that exercise always reduces the incidence of all lifestyle diseases, be it a hypertension or be it a heart attack or diabetes. It also has got a favorable effect on your blood sugar control, so also on your cholesterol control. So there is a very popular phrase, a heart always says, you walk 1 hour for me, I will continue to beat for you for a long time. Taking stairs, 5 stairs or 6 stairs is a very good exercise for 2 things. Number 1, yes, it also is an exercise. Number 2 is while you are climbing stairs, if that person gets some chest pain or burning sensation in the chest or extreme tiredness, that points to a hidden heart disease. So in that way, it has 2 advantages. So I recommend always to take actually stairs and avoid these lifts. Unaccustomed exercise, high intensity should be avoided. If you are not that is the reason whatever we have what is called a warming up period. So gradually your level of exercise should increase for about 2 weeks, moderate intensity. Then maybe for next 2 weeks, little higher than moderate intensity. In a phased manner, you should increase the intensity of exercise. Again, a precaution for youngsters or teenagers, abruptly you should not lift too much of weight. It can be dangerous.
Sir, in your opinion, what are some strategies or the best strategies really for preventing heart disease in the first place?
Maintain a very good health of the heart. Keep 5 things as low as possible. Keep 5 things as low as possible. So what are those 5 things? Number 1 is blood pressure. Number 2 is blood sugar. Third one is blood cholesterol. Fourth is your body weight and waist circumference. Fifth is overambition. And these are the 5 things you have to keep as low as possible. And again, most important, you have to keep walking. That is walking is important, and it should be part of your culture, and it should be part of your day-to-day life. And another important thing is, yes, whenever when there is a strong family history of heart diseases is there, take precautions right from childhood. All preventive measures for blood pressure as well as heart diseases should start from childhood. And also mothers also should not feed them with lot of fatty food or salt rich or whatever enriched cholesterol food, because mothers, they want their babies to be chubby in the childhood, but it should not be carried into teenage or adulthood. That is very important. And I recommend, because the burden of cardiovascular disease is so high in India, we always celebrate this anniversaries, wedding anniversary. So after the age of 35 for men and after the age of 40 for women, I think we should celebrate medical checkup anniversary. Once a year, check for your blood pressure, blood sugar, and cholesterol. And also, if there are any of these things are abnormal, undergo a treadmill ECG. the treadmill ECG or exercise treadmill ECG will it will predict quite early whether you are going to have blockages or not. So these are some of the preventive measures we need to take for a healthy heart. And we have to, most important, who is your best partner? Your best partner is not your brothers or not your sisters, not your husband or not your wife. Your best partner is your body, because ultimately body is going to be with you since as long as you live. So you have to take care of your body, and it should take care of your health. So that is my message. And lastly, because today the medical profession has become a war zone, and because of this undue stress we are facing today, day in and out in the profession, our doctors are becoming vulnerable to lifestyle diseases. A stage has come, unfortunately, because of all stress, the doctors are becoming patients. They are not giving much of a thought towards their health. So doctors also should take care of their health. This is very, very important. In fact, the average lifespan of a modern day doctor has come down by 10 years. Very unfortunate. So on this World Heart Day, it's not a message only to the patients and also to the doctors. We tend to neglect a lot of things. We should also undergo a periodic health checkup. Then probably we can also have a very good, healthy heart. Another thing, the smile is very important. So everybody, smile is one thing we should inculcate into our day-to-day life. It's extremely important. Smile is also, because as we know, smile is the best cosmetic, we say. Smile is the best jewelry, and smile is also the best medicine. So whether it is smile or whether it is walking, both are free, and we should inculcate into our life.
So given that we live in India, two things that I can think of that happen around here quite often are pollution and stress. So do you think that stress and pollution do play a role in heart disease? And if so, what is it?
See, air pollution is a new tobacco. Air pollution kills more people than smoking. So particularly in third world countries, even all international cardiac societies have said, even American Heart Association, European Heart Association, even our own countries' health bodies have said, air pollution is an emerging risk factor for heart attack and related diseases. Because of course, the most common cause of air pollution is vehicular emission, and sometimes also coming from industries, burning of weeds and all those things. Particularly the various components of air pollutants, particularly less than 2.5 particulate matter, is extremely injurious to the blood vessel as well as to the heart, because it has been clearly shown in various studies. This particulate matter less than 2 micrometer in diameter, they can easily go through the air into the lungs. From lungs, they get deposited in the arteries of the heart, resulting in clot formation and resulting in these sort of diseases. We all need to take some amount of stress, then only it propels you. But extreme stress is unquestionably an important risk factor for cardiovascular diseases. It could be a career stress, maybe a student academic stress, could be some business stress. So because we know that stress always increases your heart rate, it increases your blood pressure. So I think nowadays all youngsters, particularly in their age group of 20 to 40, are extremely susceptible to the stress. And this is because stress, by definition, it is just a gap between your performance and expectations. So if your performance is less than expectation, they will get into stress. In fact, this stress is also playing an important role as far as women are concerned. At one point of time, we thought women are immune to your heart attack. Today, that benefit is totally lost. because many women are working like men, what we call it as men-ish women, except for reproductive or those phases, they are exactly like men. And in fact, 4 decades back, heart attack was rare in women below 50 years of age. Today, even they are also catching up. We are seeing heart diseases in women, in premenstrual women, as young as 30 years, 35 years. So this is a real problem. That's where it's because today all stresses are deposited in a bank called women. We all know today 50% of deaths in India is due to non-communicable diseases. Nearly 25% of the deaths in the country is due to cardiovascular disease. So both hypertension as well as coronary artery disease accounts for nearly 25% of mortality and morbidity. Unfortunately, in India, all these things, whether it is high blood pressure, whether it is diabetes mellitus, or whether it is heart attack, occurs at an younger age by 10 to 15 years compared to Western counterparts. So this is a great, not only a great loss of life and loss of productivity, and also families also get deserted. So it is an important public health problem. So the need of the hour is to really how best we can control and contain this menace of cardiovascular disease, in particular high blood pressure as well as heart attack. So prevention is better than cure, but still precaution is still the best. So your cardiac health is in your hand, and it is in your food, and it is in your thought, it is in your physical activities. So I think on this World Heart Day, the need of the hour is to create awareness among the public and also among our medical fraternity. What are the precautionary measures we need to take, and how best various policy makers can come into the picture, and so that India can really be proud of having less number of cardiovascular diseases.